First aid. So important to ham radio, particularly if you go outdoors. Parks on the air, especially summits on the air, if you're going to be doing a lot of hiking. I have tried to instill the importance of first aid by having guests like USN ER Doc here on YouTube, W6RIP Kevin, Adam, K6ARK. So many people we've talked about first aid and its importance when you go outdoors, because I want to keep you all safe and active hams. So today we're looking at 2 first aid kits. These were sent to me from Refuge. They sent me 2. This is what you would call a personal first aid kit, or a PFAC, and then I don't even know, a squad bag, an adventure bag. This is some serious stuff right here. Personal first aid kit, this one is pretty well stuffed, so this will probably do for a couple of people, probably your whole family. Don't trust my word, though, because I am not an expert in this area at all. I wanted the opinions of people who actually administer first aid out in the field. So when we were at Thomas Mountain, I took that opportunity to, again, pick the minds of Kevin and Adam out in the field, and we go through all of these. So let's take a look and hear their thoughts. How's it going, everybody? Josh, KI6NAZ. I have 2 search and rescue volunteers with me, W6RIP Kevin and Adam, K6ARK. Refuge sent us some medical kits, and while I can do some medical things, I thought it would be a lot better if these guys gave their opinion on how these are loaded out. So we'll start with the PFAC, personal first aid kit. Who wants to take a look at it?
Yeah, let's bust this thing open.
Well, jump in there. And
the first thing I notice is the solid construction on the case.
Yeah.
And I see an external Velcro pocket here, and then a zipper on the side here. So I'm curious what's in the external Velcro pocket. And this is S-Mark bandage. I assume this is a blood stopper type bandage.
It looks like a elastic tensioning, like tourniquet kind of thing.
Oh, maybe.
Like a SWAT bandage.
Okay. Ah, yeah, okay. Continue to hold direct pressure onto wound until bleeding is stopped. So it's a blood stopping bandage. I don't know if it has a hemostatic agent in it or not. Mm-hmm. We'll have to check that out and maybe stick it in the comments there. Let's see. So inside the main compartment here, we've got some burn gel. So it looks like some antiseptic type stuff and burn gels.
Yeah.
Nice little assortment there. Oops. Burn gel, povidone iodine pads.
Yeah.
So these things are pretty nice. You can even take those and stick them in like a water bottle to get a diluted iodine solution to rinse a wound.
That's what USNER Doc was talking about when we had him on the stream.
You'll get a pretty low concentration,
Sure.
but it's still going to help. It's going to help purify that water and help you with the... thank you. So a bunch of burn gels, sting and bite pads. Those are good for knocking down the itch and the sting. Mm-hmm. Antiseptic towelettes to clean you up, or to clean an area like perhaps around a wound, but generally I'll be using those for myself after working on somebody. Triple antibiotic ointment for wounds to help prevent infection. So yeah, some good standard stuff there.
Boo-boo kit.
Yep, you got your Band-Aid kit here, your Curad Band-Aid, some butterflies in there, and other knuckle shapes as well. Good little variety. This is gloves. Got to have your nitrile gloves. I'd probably put a few more in there. There's at least 2 pair.
Yep.
Looks like that's a good start. There's a mini compression bandage. Let's see here. So this looks like the kind of the
it's like
elastic.
An Israeli looking type bandage.
I don't know that it's an Israeli bandage. I think it's more like a wound covering.
I kind of mean the material.
Elastic.
The material of it, doesn't it? A little bit.
I think it's more like Ace Wrap style stuff.
Oh, okay.
But it says it has no latex, which is nice. It's sterile as well.
Yep.
But it does look like a stretchy wound covering there. And then looks like we've got a wound management kit here with gauze pads, roller gauze, and a Sharpie in there. That's nice. Be able to make notes, mark stuff up as you're treating there. So steri strips here for closing larger wounds that you don't have any other options on. A larger abdominal pad here. Let's see.
I think that's a splinter. Yeah.
Okay, it's a splinter remover tool. And then some duct tape on a little plastic form there.
You don't normally see that.
No. I guess you could use the plastic as a splint or something.
Yeah, so the abdominal pad, it looks like is, the waterproof style on one side. So it's got the plastic barrier and some adhesive around the edge, I think, on that one. Couple roller gauze. Always nice for treating wounds and stopping bleeding. Use those to put some, pack a wound or use some direct pressure.
Yep.
And then different size gauze pads for cleaning and bandaging wounds there. All right. What else? And then some tape. You got to have your tape to patch up the Sharpie in there as well.
Yeah, so I know you use a Sharpie like if you put a tourniquet on somebody, but why would you want a Sharpie other than that?
Yeah, so Sharpies are good for noting times on things. They're also good for if you have like an infection or particularly a snake bite to mark the time and the location of the tissue damage. You can kind of keep track of progress on that. So yeah, it can be useful for that
something you don't normally see in a first aid kit.
Yeah, no, that's pretty good.
So what do you think for the PFAC?
I think this is a great little personal kit.
Yep.
Let's see what I would probably add to this, and you really never buy a first aid kit and not add anything to it, and there's a little bit of room in there to add stuff, which is awesome. So I would probably add one of the emergency CPR masks. That's a nice thing to have in there.
Yep.
Just the small barrier, one-way valve. I'd probably throw in a few more gloves. I'd put in some blister treatment stuff because that's one of the very typical things that you need to take care of for yourself or others on the trail. Moleskin, the duct tape can help with that, but I'd add some little tincture of benzoin packets. And then I'd probably add some various basic medications, vitamin I, your ibuprofen, Tylenol, so acetaminophen, and then diphenhydramine, your Benadryl, for allergic reaction type stuff. Those are kind of the three basics that
definitely
I always
Benadryl.
Yeah,
when you're outdoors.
And I'd probably throw some mini trauma shears in there too, some good scissors.
Oh,
'cause that's really handy.
That's a good idea. That would fit too.
All
they're
that
flat.
would fit.
They'll fold right in there.
So yeah, I mean this is a solid start, and a solid small first aid kit to bring out on a trip like this. So very cool. And the other thing I noticed with this is it's all very high quality material inside here. It's not kind of your junk in a cheap first aid kit you get on Amazon.
Right. Where it's a lot of the bag is cheap, all the bandages are cheap.
Yeah,
they're going to expire in a couple of months,
or it's just not even going to stick to your skin.
Right.
So those are kind of key elements in a first aid kit.
Yeah.
So. Kevin, any other thoughts from your perspective?
Yeah, I mean, you could always one step up depending on what your hobbies are. If you look like at your tourniquet, you look at your quick clot, your wound packing material. You go out shooting a lot. So, but I agree. I think it's a great little starter kit to build on.
Yeah.
And
I think it'd be good in a pack if you're like doing a soda or something like that. It's not very big. Something you should definitely have on you.
Probably a little more than what you need.
Think so?
Yeah. It's definitely a little more. If you're taking your whole family out for
this is just their personal first aid kit. We haven't even gotten the big one yet.
Something that we would put together just, would maybe be a quarter of that size.
Really? Okay.
Yeah, it could be.
Yeah.
And probably like you, I've got a wide range from stuff that, fits in your pants pocket easily up to, that size for a more of like a vehicle kit.
Right.
Yeah. So, yeah. Big range, but yeah, awesome. This is I'm impressed. It seems like a great set of stuff, and there's nothing in here that I'm like, this is junk, I'd take this out.
Right.
Hey, that's a good point.
Yeah.
There's nothing that you immediately said, lose this.
No,
This is trash.
I like that it's red, it's bright, easy to find.
Yeah.
Hey, get it. You have it somewhere. Get the red bag in my car.
Right.
Something like that, because sometimes you can't get to it.
Yeah.
You got to be able to have solid instructions to someone to go find it in your vehicle for you.
Yeah. And looking at expiration dates on the ointments and stuff, it's all in 2024, October 2024.
So, it wasn't
about November 2024. So you get a solid couple of years out of this. Yeah. That's great.
The small kit is $89.99. It's called the Boo Boo 2.0. But obviously what's in here actually has some blood stopping capability in it. It is at refugemedical.com. If you use the code HRCC, you'll get 10% off. I am not affiliated. This is not an affiliate link or anything like that, but they did send me these kits to take a look at. Now, the big bag, this is the Adventure 2.0. This comes in at $579. This goes beyond like an EMT bag and even a first responders bag because there's actually surgical equipment in here. There are a ton of blood stoppers. It is basically like 2 of these plus a ton of other stuff. Anyway, why am I babbling? Let's just hear the guys talk about it. Okay, the big bag. There's a lot in here.
Yeah,
so I'm gonna let you start diving into it, but I did have to kind of open it like this and then fold it like that to get going. But there's a lot in there. So you see the shears jumping out.
One thing I would probably prefer out of a bag like this would be one that folds open all the way for quick, easy access.
You can like fold the lips open if you will.
It still opens up
pretty good.
It still opens up pretty good, and it makes for relatively easy access. And I can see that stuff in here is well organized into sections and bags. So what I'm gonna guess that the different bags in here kind of have different functions for treating different types of injuries or medical problems. And I might even take a Sharpie and annotate what each one is. Bleeding, trauma.
I think they might have actually. If you pull some of them out, I think they might be named.
Fair enough.
I could be wrong.
I don't see a name on these.
Not on that one, no.
So this first bag I pulled out. Well, I'll pull out one thing first. Nice trauma shears here. Your pretty typical stamped sheet metal ones, but they'll cut through pennies, as people like to demonstrate. Bunch of gauze pads in here, and something else in here that I'm not familiar with.
That is an eye shield.
Ah, awesome. Very cool. Yeah, so a couple polycarbonate eye shields. That's a nice addition. Non-adherent pads for wound coverage and treatment. These are eye pads. Cool. And then a whole bunch of gauze.
Wear your eye protection, folks.
Yes, definitely wear your eye protection.
Eye trauma.
So we've got
it's a series of gauze. Yeah.
Gauze and trauma dressings, things like that here. Stick that back in my
I'll do it. You go ahead and keep going.
Yeah, I don't want it to blow away.
Yeah.
Let's see here. This is a Sharps container.
I thought that was interesting.
Yeah.
That they include that.
It is interesting. Makes me curious what else is in here. Let's see here. So we've got another abdominal pad, like in the other setup there. So if you have a abdominal wound, that's a good thing there. So this is a nasopharyngeal airway. So if someone is unconscious or has an injury that is preventing them from breathing through their normal
their mouth parts.
mouth parts. You stick this in, you get it wet, ideally with their saliva, as some lube. You stick it into the nose and it goes down into the throat.
They got a bit of...
Oh, they got lube with it. Awesome. So you don't even have to use their saliva.
Well thought out, yeah.
Yeah. So that's a really good and useful tool. These things are great for helping people breathe that are in critical situations. So very cool. This is, it's called a halo vent.
I think that's a chest seal.
I think it is, yeah. So if you have a...
Sucking chest wound, right?
Yes, if you have a wound through your chest cavity. So the way you breathe, when you inhale, your diaphragm sucks down into your abdomen, and that pulls air into your lungs because it creates a vacuum, basically, in your chest around those. And if you have a hole in your chest, it just sucks air in through that rather than into your lungs. So that's what this is for, is to treat a chest wound like that. Super compact, high quality material here, and a really important tool to have for a big trauma issue.
Yeah, I'll put that away. You keep diving. There's a lot to go through.
Cool. So we're looking at another bag full of the little wet pads. It looks like the same stuff in here. Yeah. Antiseptic towelettes, antibiotic ointments, povidone iodine, alcohol prep pads, which are also nice and useful in there for cleaning up areas. I think that covers everything.
Yeah, I think
Stingies.
Same as the small one, just
more.
A lot more. Yeah.
The basic first things.
Let's see here. So we've got a whole bunch of trauma pads and gauze dressings in here.
So that one does have a gun on the front, right? That bag? Turn it around.
Surgical kit.
Suture surgical kit. Awesome. Okay. So that's yeah. So this could also be really useful just to manage bleeding and trauma dressing, or even potentially burns and things like that, to help dress wounds with nonstick gauze pads and things like that. Some more of that gauze in here, and then these are so these are suture material,
Pre-threaded nylon,
monofilament, non-absorbable suture. All right. And there's a whole bunch of them in there.
No, it look like. Can I see this?
Yeah. Why don't you hang on to those for me?
So, it's different sizes. So that's a 5.0 with a
2.0,
3.0, 4.0. Man, that's a lot.
Yeah, there are a lot in here. So for what it's worth, these go beyond my level of medical training.
Right.
And would not likely be something I would use in the field. But however, I mean, you often encounter people with higher medical training, either in the field, in the group that you're helping take care of, and things like that could certainly be useful to them. More povidone iodine. You know, infection is a critical element anytime you're dealing with open wounds, and that's going to help manage that. A couple mini rolls of tape. Tools in here.
Man.
Scissors, hemostats, tweezers.
Oh man, they're straight
more
up
hemostats. And some scalpels.
Scalpels, yeah.
Scalpel blades. So.
And that's the handle. It's the scalpel handle.
Yeah, there you go. Okay, so it wasn't too
Wow.
much. It is scalpel handle.
Yeah.
Got it. Cool. And then more gauze pads here. Whole bunch of gauze pads. So yeah, this is a
more advanced.
legit surgical and suture kit. You could do some serious work with this with someone with the right skills and training.
Yeah.
So, and a drape cloth too.
Yeah. Wow, that's a lot.
Wow, this is impressive. All right, I'll let you work on that.
I'll do it. Yeah.
Nice.
So we do have some medications in here. We've got the anti-diarrheal and Benadryl, both really useful tools in the field.
Yeah.
Simple medications that can keep a bad situation from getting worse. Got some self-adherent wrap here, aka vet wrap for any of you that have
Vet
animals.
wrap?
Also known as vet wrap, and there's I can't think of the other name for it, but very useful stuff for bandaging up wounds. You've got an ace wrap, also very useful for bandaging wounds and for splinting. I like to use this to cover up the SAM splint and protect you from sharp edges and pressure points. And the SAM splint, excellent splinting tool. This is a larger size one. This is the XL version, so 42. What is it?
Is that just
4¼ by
one?
36. That's just one.
Wow.
Yeah, it's 36.
Yeah. So you can use these for a lot of things. You know, splinting limbs, legs, arms, wrists, elbows, and you can even use these as kind of an improvised cervical collar if you've got someone with a potential spine injury that you need to help stabilize.
Does it have metal in it or something?
It does. It's aluminum. Sheet of aluminum.
Sheet of aluminum.
Yeah.
Form.
It's like a foam outer and inner, but it's different types of foam, kind of. Interesting.
Yeah, exactly. So we've got the trauma pack here. So this is going to have a bunch of our blood stoppers and things like that to manage trauma. We've got some nitrile gloves in here. We've got another eye cover, I think, there. More gauze pads, always important and useful. Some good strong tape here. I don't know what type of tape that is, but it's some kind of a wound closure tape, I think. Not familiar with that one. More eye pads, gauze eye pads. Antiseptic towelettes to clean up before you dive in, and after, for that matter. Some more gauze pads, and another abdominal pad.
Yeah.
I like how they've organized things in here, and they have some of the same stuff in different bags, but they've totally organized it for like a specific purpose, right? So the thing I would probably add is just on the top of this, you know, trauma, surgical. So you open it up and you can just pull the right one out immediately. This looks like cotton gauze slim Z fold. I'm not familiar with this one.
Oh, that's like a Z pack.
Okay.
The gauze that pulls out.
Yeah. Got it.
Like an accordion.
Yep. your emergency blanket when people are
Going to shock.
Yep, when they're dealing with shock, they are much more susceptible to cold challenge, and that's a good way to help deal with that. Got your quick clot, your hemostatic agent to help pack wounds and stop bleeding. Actually, this is for external use. So yeah, this would go on the outside. Well aimed direct pressure on one of these bad boys on a severely bleeding wound, and you'll be able to stop most bleeds within 10-15 minutes. Wrap it up solid and get them the heck out. Roller gauze, again, very useful for blood stopping and treating wounds. And then triangular bandages. These things are pretty sweet for helping work with splints to cover up like a SAM splint, give some padding, hold things together. And also to put over your shoulder as like an arm sling. Very useful for that as well.
Fun fact, the day after Christmas, my 70-year-old father was running in the front yard after my two sons, Ben and Edison, and he fell. And he ended up actually fracturing the upper side of his humerus on the left-hand side. And what I went and grabbed this immediately when he told me we got to go to the emergency room. I thought maybe he could just, sit it out. But no, there was something seriously wrong. So we splinted him, and we used the triangular bandage to get him immobilized some and got him to the emergency room. So good to have on hand. You never know when you're going to need it.
That's the trauma pack.
So this is a quick clot dressing. It's a dressing
pad.
Right.
It's
you
in the
put
gauze.
the pad on and then you wrap it up.
Right.
Okay.
Yeah.
Apply
It's
pressure.
Rather than
It's a
just wrapping
soaker.
it up, you want to push on that.
Right.
A whole bunch of direct pressure with a couple of fingertips. And
Okay.
It'll soak and swell.
Have you had to do one of those before? On somebody?
no, fortunately, I have not.
God.
Burn
Definitely
shield. So this is a burn dressing. Burns can be exceptionally dangerous things to deal with, especially in the wilderness, and that's an important tool to help manage both the pain and control infection for your patient with that. 2 packages of burn gel. Got your Sharpie here as well. Let's see what else. We've got a tourniquet in here, SOF brand tourniquet. So quality tool there.
And that's a windlass tourniquet.
Right, exactly.
The twist bar type that people are familiar with.
Another Esmark bandage. So what we figured out from the last one is that this is an elastic pressure bandage, so you can use this to help hold that direct pressure on a wound rather than you having to do it full time yourself and wrap that around.
That stretchy tape you put over leaky pipes.
Right.
Right.
Totally.
Same
Good
concept.
analogy. Let's see here. We've got Olay's modular bandage. I'm not familiar with this one. For treatment of moderate hemorrhage. So I'm going to assume this is another hemostatic agent type thing. Place wound pad on injury with pressure bar directly. Oh, so it's a pressure bandage.
That's something similar to the Israeli
Yeah.
bandage.
Yeah, exactly.
It's the American version of.
Cool.
Oh, interesting.
Let's see. So we're
American
good
Israeli
there,
bandage.
and then we got
There's
one
an
more.
inner pocket,
Yep.
which looks like it has some.
So just open the inner pocket here. And we've got more gloves.
Good.
We've got some more tape, some duct tape.
This kind of looks like the pouch you might go into first, or
Yeah, for minor stuff.
yeah, this is like the
So maybe-
easy first aid kit.
Yeah, this is like your
Yeah,
you know, your non-emergency first aid. Hydrocortisone cream, deal with itches and things like that. Oral rehydration salts to deal with dehydration. Another package of that. Curad triple antibiotic ointment, a large package of that. Bunch of your Band-Aids, again the Curads.
Looks like the same thing as in the small.
Yep. Got steri strips, so your wound closure strips there. Transcend glucose. So this is basically a goo packet, and this is to help people that are diabetic and maybe low on sugar. If you come across someone who's in an altered state of consciousness or unconscious, and they have a diabetic bracelet on, odds are they're low on sugar. They could be high on sugar, and what you can do is take some of that sugar and apply it to their gums. Get a little bit of sugar into them and help restore that if they're low on sugar. That can also be really useful for someone that's hypothermic. You need those easy calories to burn to keep you warm. What we like to say is feed them and beat them. And you get someone fueled up and you get them moving, and that's the beating part. And that generates heat and gets them warm back up if you can. That's right. More skin closure strips.
These work really well. I've used these before on
Have you? Okay.
cuts that I probably should have went to the doctor and got
Yeah.
stitches.
Probably should have. And the splinter out. And one more package in here, I think. Yep.
That looks like...
So these are all of our basic meds that I was talking about that I would probably add to something like that. You've got, looks like acetaminophen. Yep, so non-aspirin. It's basically Tylenol is the brand name that you would see commonly. More acetaminophen.
Looks like it, yeah.
Some Motrin, which is your ibuprofen.
Oh, so they literally have like all the different painkillers.
And
So there's
then-
Motrin, Bear.
So you have
It's
actual
aspirin.
aspirin in
Yeah,
here
okay,
as well.
Yeah, you need to.
So yeah, those are kind of the three, you know, that you want for
they
different.
all the same?
Yeah, those are all.
Yeah,
I
you
think,
just leave them
Bayer
in there.
aspirin.
Bear aspirin.
So aspirin, acetaminophen, and ibuprofen, kind of different, you know, slightly different
These are a
purposes.
little on
different
the higher
focuses.
on the milligram thing. I was wondering if
Are
there'd
they?
be some of the ones that were smaller for if somebody's having chest pains and
Okay,
little things like that. Yeah.
cool. And
'Cause
these,
they've got the heart logo on there.
you're not going to
Well,
see as far out of expiration dates on these because they just, you know,
Yeah,
I think they're usually
yeah.
a year from manufacture
Yeah.
or something like that. So, but they're easy to replenish. So yeah, this is awesome set of stuff in here. I think if I tried to think of something I would add to this, I would probably add a syringe, a large syringe for wound irrigation to wash out a wound. Because
Yeah.
you know, some of the common things you encounter, at least I do in the wilderness, are a cut or a scrape that's got dirt or nasty stuff in it, and you want to get that out and make sure it doesn't get infected. And a big syringe can help with that. I might also add, I think it would fit in here pretty easily, just a full-size CPR mask. You know, just the mask with the valve that protects you if you need to do CPR on somebody.
Yeah. What do you think?
Yeah. No, it's a lot in a little bag, and
Yeah.
everything that we noticed, everything we kind of mentioned from the first one came in this one.
Right.
Yeah.
You know, all the things that we would add.
Yeah.
I like it. It's really nice. This is from the Netherlands. I looked it up.
Oh, nice.
These are from South Africa.
Okay.
So it
Wow.
seems like maybe some of the stuff from all over the country, maybe hopefully it's the best selected stuff and it's legit, but it's got like everything, almost everything you need.
Yeah. And then
It's
some.
well thought out, and it's in a small pouch. I would prefer a red bag. You know,
Yeah.
if you have black camera bags in your trunk or any
Yeah.
kind of black camping bags, you can't just yell somebody, "Hey, grab the black bag." You know, like,
Yeah.
But it's something that, you know, it does have. You could put.
I
Some
would
other
like
patches on here.
the Red
Right.
Cross
Yeah.
on the bag. I would probably do that on both of them
But
personally.
maybe they probably sell it. You know,
Yeah, I'm sure they do.
probably do.
Yeah.
So
Yeah.
but,
Very good.
Really good stuff, and you know, it's really good to have all these little guys. You know,
Yeah.
for allergic reactions and.
Yeah.
Well, thank you, Refuge, for sending this out. Hopefully, we won't need to use this on the camping trip we're on right now. But yeah, it looks really well thought out, so
Yeah.
I appreciate it. Links in the description. You guys can go check it out if you're interested. Refuge Medical Training, and I guess they do have training as well as obviously just making these kits. So go check out the website. All right, guys. Thanks, Kevin. Thanks, Adam. Appreciate you guys.
Yeah. Quality stuff.
If you got to the end of this video and you're interested in first aid, I would like to say that, you know, just like programming a Baofeng or learning HF, building an antenna, there's no excuse for not having training to go along with this. I would consider a Stop the Bleed course or multiple first aid classes. They are available at the Red Cross, and these are all things that you can look up, possibly even locally in your local communities. Take a CERT class. There is a rudimentary first aid training that goes along with these. Please, 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 it's a tool. You got to be able to deploy and use the tools effectively, so get training wherever you can. I'm Josh, KI6NAZ. Thank you so much for watching. I got another video here that you might like, maybe first aid related. 73.